You giving out advice to people taking antibiotics saying, finish the course?
Yes, absolutely. It's sensible advice. We follow guidelines, clinical guidelines, and it tells us how long you should be taking an antibiotic depending on the condition. Now, looking at this actual article, which is in the BMJ, there are 7 consultants, prestigious consultants from Brighton, Southampton, Oxford even, and the Royal Free. And what they're suggesting is that, one, change the term from complete the course to take exactly as prescribed. Now, we all agree that's fine. If they want to change that, that's fine.
Same thing, really.
Yeah, same thing, really. I don't know quite what the difference is. But then they're saying that we should change, there's a fallacy, and if you stop an antibiotic early, it will cause antibiotic resistance. And that, he's arguing, is wrong. He says there's no evidence to that. He's saying it's quite the opposite. If you take it longer than necessary, i.e. after you're cured, and you continue to take the antibiotics, that will cause antibiotic resistance.
Do you think there's something in that?
Sense. It makes sense because you've got good bacteria, you're exposing them to antibiotics longer than is necessary for a particular infection, and then the good bacteria could become pathogens.
But it's not an exact science taking antibiotics, is it? You just don't know when they've worked, and it's not necessarily when you're not feeling ill anymore.
Exactly. And so in a hospital setting, it's absolutely fine if the clinicians want to curtail treatment, because then they can do blood tests and cultures and things like that. But in the community, it would be quite dangerous for you to stop if you suddenly feel better, because you could still have an underlying infection, and people worry about it coming back with a vengeance and them getting sepsis and etc. So we wouldn't want patients to take that gamble in the community.
The background to all of this, though, just very briefly, is we need more antibiotics, don't we? Because some are not working anymore as they should.
Yes, the concern in the article is about superbugs. It's about bacteria being resistant to the antibiotics that are out there, so we've got to curtail treatment with antibiotics. We've got to control what's happening there. However, I think doctors are prescribing as they should, and we do have clinical guidelines. If they want to change those guidelines, they'd have to approach NICE and do it properly.
So still listen to the doctors, of course. Una, thanks very much indeed. Good to see you.